Hi, my name is Laura, and my group members are Mel, Andrew, and Shannon. Our skin disease topic of choice is leprosy. So, what is leprosy? Leprosy, commonly known as Hansen disease, is a chronic infectious disease caused by the microorganism Mycobacterium leprae, which affects the skin and nerves. Leprosy is a long lived disease, and according to the World Health Organization, it is estimated that over 180,000 people are affected worldwide and has been around from as early as 400 BC. Despite there being a negative stigma associated with leprosy, it is rarely contagious due to its slow growth, which results in symptoms taking approximately 3.5 years to appear. It generally spreads through repeated contact of the nose and mouth droplets. So, the signs and symptoms of leprosy. Leprosy primarily affects the skin and the peripheral nerves. It may also affect the eyes and thin tissue lining of the nose. The main symptoms of leprosy are disfiguring skin sores of a pale colour, lumps or bumps that do not go away after several weeks to months. Nerve damage due to leprosy can lead to muscle weakening and loss of feelings in the arms or legs. The susceptibility to this bacterium can further inhibit the immune system. So, the diagnosis of leprosy. Leprosy requires multiple methods for diagnosis, which includes common signs and symptoms, skin biopsies, and classification based on bacterial load and type of skin lesion. This is determined by the Ridley and Jobson scale. Ridley-Jobson is classified on three major groups based on their immune response. Early diagnosis is important to ensure that health practitioners can implement treatment options, which will prevent other physical disabilities that may have a negative impact on the patient, which include their social life or their working life. Another type of classification that can be used to diagnose leprosy is through the use of a polymerase chain reaction. PCR aids in defining leprosy histopathology and drug-resistant strains of M. leprae. So, who's at risk of leprosy? Countries found with the highest prevalence of leprosy are found in low-resource countries such as Brazil or Indonesia. The highest incidence of leprosy is seen in India, with over 17,000 cases and around 60% of all cases reported. Furthermore, patients that had recently been diagnosed with leprosy are children less than the age of 15, as well as being diagnosed with grade 2 disability. So, potential complications due to delayed diagnosis can lead to disfigurement, hair loss, permanent nerve damage, chronic nasal congestion, nosebleeds, and collapse of the nasal septum, blindness, kidney failure, infertility, and itis. So, the clinical course of leprosy. As the disease progresses, lesions tend to destroy the normal skin organs such as sweat glands and hair follicles. Superficial nerves that lead from lesions tend to enlarge and are sometimes palpable. The patient may experience several neuropathic pain. A patient's susceptibility caused by M. leprae will be genetically determined on the development of the disease. The variability of leprosy is highly dependent on the number of lesions and patterns, which will vary from person to person. So, the types of leprosy. Tuberculosis leprosy is a moderate contagious infection characterized by hypopigmentation of the skin. During this stage, fewer lesions are present with the absence of a papular margin. As a result, the bacterium gradually insults hair loss, nerve damage, and changes to perspiration. If not attended to, tuberculosis leprosy can progress to lepromous leprosy. This stage displays chronic implications, leaving patients with long-term complications. During this phase of leprosy, the skin is covered with pale macules, which is skin discoloration. A study conducted depicted that lepromous leprosy is more likely to be contagious. So, the transmission. Transmission of leprosy occurs through aerosols and from the nasal and respiratory mucosa, generally spreading through repeated contact of the nose and mouth droplets. This is a case study of leprosy.
This boy Rajiv Pandey is diagnosed with a case of leprosy, presenting features, nodules here in the arms, also in the ears, both the ears and other hands. When we find that a child is suffering from leprosy, this is a very sad thing. And when such things happen, particularly the disabilities and deformities, psychological they are upset and they feel that they are being discriminated by their fellow beings. That is a very sad state of affairs. The living conditions, as I said, is very, very poor. You see a very small house of 7 feet into 7 feet, no ventilation, congestion, very congestive and very poor living condition is there. Due to the less cell-mediated immunity, this child has got leprosy. It is important to detect cases early so that if they are treated early, the transmission will be stopped. No more cases will be, again, it will be transmitted. If they are detected early and put under treatment, there will be no more disabilities, there are no more deformities, so that those people can lead a normal life and mainstream to the society.
So, treatment of leprosy. Pharmacological treatments recommended for leprosy is based on multiple drug therapy. Multiple drug therapy consists of antibiotics, rifamycin, dapsone, and clofazimine to prevent infection and reduce morbidity. A common drug used within leprosy is rifamycin. Rifamycin is a powerful bacterial drug which inhibits RNA polymerase and causes an effect on the microbacteria on the skin. Recommended dosage for adults requires 600 micrograms once a month and should be taken during meal consumption. The combination of drug treatment avoids the bacteria becoming resistant to regimes, with treatment ongoing for 6 months to almost 2 years. Considering these treatments can be difficult to balance, as individuals can become drug resistant over periods of time. So, the World Health Organization and their strategies. In 2016, World Health Organization launched its Global Leprosy Strategy between 2016 to 2020, accelerating towards a leprosy-free world. The strategy focuses on avoiding disabilities, especially among children. It is structured following three core pillars. The first pillar, strengthen government ownership, coordination, and partnership. So this is contributing to universal health coverage and a special focus on children, women, and undeserved populations, including immigrants and displaced people. Also, promoting partnership with the state and non state actors and promoting insectoral collaboration and partnership at the international and national levels. Pillar 2 is to stop leprosy and its complications, promoting early case detection through active case findings, such as campaigns in areas of higher countries that need management. And secondly, they ensuring prompting start of and adhere to treatments, including working towards improved treatment regimes. And pillar 3, stop discrimination and promote inclusion, promoting a collaboration building among persons affected by leprosy and encouraging the integration of these collaborations with community-based organisations. And secondly, promoting access to social and financial support services, for example, facilitating income generation for persons affected by leprosy and their family. These are our references, and thank you for your time.